Coming to potassium handling, the kidneys play a major role in the maintaining of potassium balance. It helps in maintaining a balance between urinary excretion and dietary intake of potassium, thereby ensuring potassium homeostasis. Glomerular filtration. Because of potassium is not bound to plasma proteins, it is freely filtered by glomerulus. The potassium is the plasma electrolyte that is both reabsorbed and secreted into renal tubules. Reabsorption of potassium by proximal tubule. About 67% of the filtered potassium is reabsorbed by active transport in PCT. In PCT, the amount of potassium reabsorbed is a constant fraction of the amount filtered. Reabsorption of potassium by loop of Henle. About 20% of the filtered potassium is reabsorbed through thick ascending limb of loop of Henle along with the sodium reabsorption. Reabsorption and secretion of potassium by DCT and collecting duct. The distal tubule and the collecting tubule are able to reabsorb or secrete potassium. The rate of potassium reabsorption or secretion by DCT and CT depends on variety of hormones and factors. Most of the potassium produced in the urine is due to secretion of potassium in the DCT, which contributes approximately 75% of the excreted potassium. The potassium secretion from the blood into the tubule lumen is a two-step process which involves an active as well as passive process. The first step is uptake of potassium from blood across the basolateral membrane into the DCT by sodium potassium ATPase, and this is a critical step and is associated with active sodium efflux via sodium potassium ATPase. Then the elevated intracellular potassium is so achieved favors the net potassium diffusion at the apical membrane down the concentration gradient into the tubular lumen. Factors which are affecting potassium transport. The plasma potassium is an important determinant of potassium secretion by DCT and CT. Hyperkalemia, for example, which are resulting from high potassium diet or from rhabdomyolysis, stimulates secretion of potassium. Tubular secretion of potassium is markedly decreased in potassium and sodium depletion. In DCT, the potassium and hydrogen are both exchanged for sodium, in which reabsorbed, and the two ions compete for the exchange mechanism. Therefore, potassium excretion is decreased when H plus ion secretion is increased. Flow of tubular fluid. The rate of potassium secretion is proportionate to the rate of flow of tubular fluid through the distal portion of the nephron, because with a rapid flow there is a less opportunity for the tubular potassium concentration to rise to value that stops further secretion. Then mineralocorticoids, for example aldosterone, increases the potassium secretion by increasing the activity of basolateral sodium potassium ATPase, which increases potassium entry into the DCT, and second by increasing the permeability of the luminal membrane